Hey everybody, a little bit of a different venue here. Today we're going to look at vital signs. So this is video 52. We only have a couple more videos left in this unit, so make sure you're staying up to date on these videos and on the video quizzes. So one of the major vital signs that is looked at when you are going to a doctor, one of the first things they'll do is check your blood pressure. Blood pressure exists in all of your blood vessels, but it is higher in your arteries and lower in the veins. And for our purposes, we're ignoring the pulmonary artery, pulmonary vein here. So your blood pressure is highest in the arteries and lowest in the veins. It's a measure of how much force your blood is exerting on the vessel walls of those arteries and veins. And blood pressure relies on a gradient. It relies on you have your highest pressure in the aorta and your lowest pressure in the superior and inferior vena cavas, because blood is liquid. It's going to move from high pressure to low pressure. And so with that highest pressure in the aorta, lowest pressure in the vena cavas, that means that even if your blood wasn't being pumped, it still would generally move in the correct direction, going from arteries, arterioles, to capillaries, to venules, and then to veins. And so the higher pressure is going to force blood to keep moving towards that lower pressure. We'll see by the time in the vena cavas, by the time it gets to the right atrium, blood pressure is basically zero. Issues with blood pressure, though, high blood pressure can cause those blood vessel walls to rupture because they just aren't strong enough to be able to withstand all that pressure. Low blood pressure could cause blood to stop flowing. So if the difference between the blood pressure in your aorta to your vena cavas is very, very low, then blood is not going to want to move in those directions. And so you're going to have a tough time getting blood to circulate throughout the entire body. Some things that affect your blood pressure is your blood volume. So how much blood do you have? More blood volume means you're going to have higher blood pressure. You're trying to fit more blood into the same area, and that's going to increase the pressure. High blood pressure does cause some issues, but more of an issue is low blood pressure. So if somebody is in an accident where they're losing a lot of blood, or they're in surgery and something goes wrong and they end up losing a lot of blood, that is going to dramatically lower your blood pressure and cause a lot of circulation issues that you want to avoid. So that's why during surgery they want to have blood on hand to be able to do that transfusion, do that infusion if there is something that goes wrong, so that your blood pressure does not drop too low. The strength of your heart contraction, so how hard your heart is contracting, stronger the contraction, it's going to be pushing more blood into the vessels. And so basically the heart is going to be holding less blood, and it's pushing it more firmly out into the vessels, and that's going to increase your blood pressure. Your heart rate will also increase your blood pressure, but only if you're not giving your ventricles enough time to refill. So if your heart rate is increasing, that's basically going to decrease the amount of time that your ventricles have to refill, assuming that they aren't refilling faster here. And so there's going to be more blood located in your blood vessels than there is than you normally have, because there's less blood in your heart because those ventricles aren't refilling quite as fast. And so that basically, you go back to blood volume, you just have more blood volume in the blood vessels, and that's going to increase your blood pressure. And then also is blood viscosity, so the thickness of your blood. You think maple syrup is a very viscous fluid, and so the more viscous your blood is, the higher your blood pressure is going to be. Blood pressure, when we're reading it, is read in systolic millimeters of mercury over diastolic millimeters of mercury. Millimeters of mercury is just a measure of pressure that we use. Basically, it's derived from a very old setup where you would have mercury, and you'd have a tube in the center, and how much pressure is put on the outside of the mercury would push it up the tube, and you could actually measure in millimeters how high that mercury was climbing. And so that's just a way to measure pressure. Textbook blood pressure when I was in school was 120 over 80. Today it's now 110 over 70. So somewhere in between that range is normal blood pressure. Remember, this 110 to 120 is your systolic millimeters of mercury. 70 to 80 is your diastolic millimeters of mercury. One thing to also remember, systolic is your contraction blood pressure, that systole from our cardiac cycle, and then diastolic or diastole was from the relaxation phase of the cardiac cycle. So when your heart is contracting, you want blood pressure to be somewhere between 110 to 120, versus when your heart is relaxing, you want your blood pressure to be between 70 to 80. So it's read as 110 over 70 or 120 over 80 as your normal blood pressure. We can measure blood pressure with a digital monitor, or old school is with a sphygmomanometer. And we listen to the pulses that we have, or that we can hear through that sphygmomanometer. And so what you do is it's your blood pressure cuff, you'll crank it up to at least probably 200 millimeters of mercury is probably about where you want to crank it up to. And then you'll slowly let the air out. And so you'll slowly let the air out. You'll be listening to that brachial artery as you do. And eventually you're going to hear pulses start to sound through that sphygmomanometer here. When those pulses start, that means that the brachial artery has started to have blood flow through, but it's a very turbulent flow because that artery is still somewhat bent a little bit. And so by getting it up to 200 millimeters of mercury, you sealed off. There was so much pressure that you close, you close that blood vessel. As you let that air out, you'll hear pulses begin when the blood vessel reaches the systolic blood pressure. And then if you're going slow enough, you'll hear when those pulses end. That is when the blood vessel is completely open. That is going to be your diastolic blood pressure. Basically, you've released so much pressure off of that the blood vessel now, because of its relaxation blood pressure, is greater than and able to withstand the pressure from that blood pressure cuff. So we'll see if this works here. Okay. Hopefully it works. Assuming my internet lets it. Go back here so you can see they get it up to 200 millimeters mercury. Release. Start to hear pulses around 140. And then no more pulses kind of in this 90 to 100 range. So this individual here has a very, very high blood pressure based on that. So we will get some practice with this in class, but that is how you read blood pressure through with a sphygmomanometer.
Dr. Gundry, is this avocado?
Okay. So other vital signs that we can read include we can take your pulse, we can take your breathing rate or your respiratory rate, as well as your O2 sats. Pulse and respiratory rate typically get measured at the same time, because as somebody is reading them, the longer you take, the more nervous and anxious people get, and so their pulse and respiratory rate start to increase. And so usually people, they're reading the pulse and they're counting your breaths. So they're just looking for how much your chest is rising and falling. And both of those are measured in either beats per minute or breaths per minute. Usually it's easiest if you count them over 15 seconds and then just multiply by 4 to get it over 60 seconds or 1 minute. O2 saturations are going to be measured. If you've ever gone to the doctor, that device that fits on your finger, that is reading your O2 sats. Basically, that's looking at how much oxygen your blood, your hemoglobin is holding compared to its maximum possible level. 100% is going to be the best, obviously, but anywhere greater than 96 is typically what you're looking for on those O2 sats. So those are just a few of the vital signs. Again, there's many others that are taken when you go to the hospital, things like height and weight and things like that. But those are the main ones that we focus on and the ones that we'll be able to do together as a class.